Well, let's get more. We can speak now to the Syrian Minister of Health, Dr. Musaab Nazzal al-Ali, who joins us now from Damascus. Thank you very much indeed for taking the time to speak to us.
أهلا وسهلا حياكم الله.
Thank you so much for having me.
Minister, you've been in this role since March of this year, so about 5 months. You have a medical background, you've done your medical studies and worked as a doctor in both Syria and Germany. I'd like to start by asking you how you would describe the general situation when it comes to the health system in Syria today.
Since the end of March, I assumed this role, which is just a heavy going and a tough job. And that's due to the inheritance that we got from the defunct regime. There were many healthcare facilities along with other hospitals and the clinics that are devastated in shambles. More than 40% of the healthcare facilities are out of service, and also the medical education is also in decline. The pharmaceutical productions are on the downside. Many of the medical equipments are not functioning well, and the most recent ones have entered Syria more than 13 years ago. With this in mind, and against this backdrop, until now, we are still relying on the paper-based approach when it comes to noting down the results of blood tests and the patient's details. So this will make the challenges more pressing. And when we compare our healthcare systems with the neighboring countries or other European countries, and then there is a far cry. Yet with that said, those challenges will give us the impetus and the motivation to start a new public health sector that is just based on the international standards, so that we can provide just medical services to our people.
Okay, Minister, so a lot of challenges facing the sector, and you haven't had long to address them, only 5 months in this job. I'm assuming, and I'd like to know, to what extent are you bringing with you best practices that you learnt yourself working as a doctor and studying for your medical studies in Germany? Did that experience affect you, and are you bringing some of those practices to Syria?
Of course. Yes. Being cognizant of the experience of the advanced countries such as Germany will give us a good insight about the ultimate goal that we are inspiring to reach. With that said, I visited Turkey recently, and I had also visited many other Arab countries in the Gulf region, and even before assuming my role. And I know how their public health sector operates. Of course, being acquainted with those experiences will give us some just confidence on how to reach into our goal and the plans that should be in place at this stage. As far as the challenges are concerned, of course, we cannot deny that we have tougher challenges, and if you allow me, I might just delve into some of those challenges. For example, when it comes to the primary public health sector, especially the primary care, which is the gateway for just caring for patients, where then the patients are then referred just to hospitals, and others might be treated just in those clinics. So many of those centers are not operating well, and many of them are not activated to the ideal level. As for the secondary care, as I mentioned, we have sheer shortage of the medical equipment, and this is one of the most tougher challenges. let alone the distribution of the medical staff that are not distributed evenly. And in addition to the fact that we are suffering from a great shortage of them. With the pharmaceutical industries, remember Syria was exporting to 55 countries before the revolution, but due to the practices of the defunct regime and the high levies and taxes imposed on the pharmaceutical facilities, we were not able just to face these challenges. However, now we are trying to restore the relations with those pharmaceutical facilities. Speaking of the ambulance system, we have many challenges in terms of the number of operating ambulance vehicles and also training the ambulance staff and also the personnel at large. When it comes to the medical education, then this one leaves something to be desired as well. We are now introducing a new system for educating doctors. Unfortunately, at the Syrian hospital, we do not have a proper electronic system. And here, I mean the hospitals that were under the control of the previous regime, which poses a serious challenge. And let alone that we have also some financial.
الحكومة ووزارة المالية بصرف مبالغ على قطاعي الصحة
and invested huge amounts for the education and health sector, more than they just invested in the defense sector. And this is a promising sign in spite of the fact that we don't have the available resources. However, our intention is to have the education sector and the health sectors to be at the forefront of the sectors that should be allocated proper budgeting. And this is for just the first time we see this since mid-50s, where those two sectors get the most generous budgeting.
Okay, I mean, clearly, you've only had a few months in the job. It's only been 5 months. And as you've said, the list of challenges is a long list. Are there any achievements, though, so far, these last 5 months, that you at the Ministry of Health are proud of?
I
have always been trying just to define the word achievement, because when we talk about achievement, then it must be phenomenal for our country and for the region. But given the humble capabilities that we have at the moment, then therefore maybe it's a good idea to give an example about some of the stuff that we have been able to reshuffle and get organized. For example, we have restored more than 100 healthcare centers. Now they are back to service, and many hospitals have been restored and rehabilitated. And we were able also, thanks to just to the assistance of friendly countries and international organizations, many medical equipments have been supplied to Syria and to the hospitals. On the medical education sector, we have restructured this path so that we can redefine and refine the educational system, especially when it comes to major specialization, where we have just a board of specialized doctors, and those boards will be comprised of Syrian doctors who are domiciled overseas, and this could give us a good opportunity just to bring back those doctors and to also to implement the most important medical protocol so that they can be in practice here in Syria. And also at the pharmaceutical industries level, there have been many inspection visits to those facilities, and I think those visits had a great impact on increasing the quality of production of those facilities. facilities so that we are in a position where we can produce safe medications to the people with the and up to the standards and the international standard here at our region, or maybe the international standard. The ambulance system, on the other hand, has been also equipped with many other vehicles, as long as a program that is currently facilitating the operation of the ambulance system. The electronic system, on the other hand, has been implemented in one of the hospitals, in one of the major hospitals in Damascus, where people can just book appointments through certain apps on their phones. And in this way, just people don't have just to have a long wait until they are seen by doctors. And maybe the outcome of this experience will be tangible in the next 10 days. And we are hoping to just replicate this across other hospitals. And also we are trying to rehabilitate the hospitals, other hospitals. And in this regard, we have signed an agreement with Turkey under which rehabilitation of two major hospitals, one in Aleppo as the heart surgery department, where there will be 4 operational theaters and also 4 other rooms for catheterization, as well as other services. With this agreement, the operation will run for 5 years. And also in the city of Aleppo, there will be also the cancer hospital that will be quite ready to provide surgical services, chemotherapy, radiation therapy to those who might need them. And we have also just finished studying a feasible study where we are expecting to hammer an agreement with an organization domiciled in Italy, under which they will embark on the rehabilitation of many medical facilities and the operation of the hospital for 3 years. As a matter of fact, we are still waiting for the implementation of some agreements that have been agreed upon verbally with some countries in the Gulf region. When those agreements are up and running, then we believe that other hospitals will be rehabilitated and ready to go. We have benefited from the Syrian community living overseas, as they have launched many campaigns led by Syrian doctors, and also other campaigns that were supported by King Salman Center. And here I would like to express my gratitude to all those who participated in this campaign. And more than 5,556 surgical operations were carried out in the eyes, also and other just heart surgeries, some different surgeries and different specializations. Those are just the most salient features that I just wanted to touch upon when it comes to the achievements that we have made so far.
Okay, and of course, Minister, it is early days. The government of President Ahmad al-Shara has only had 8 or 9 months to turn the country around after a long civil war and a lot of turmoil. Looking beyond healthcare, how would you describe the situation in Syria today?
الأوضاع في عموم سوريا وأيضا
The situation in Syria and Suwaida, northeast Syria,
نتجول. أنا البارح ليلا كنت في مدينة وسط البلاد. عدت من
is as follows. Yesterday, I had a tour to the city of Homs, and I came back just at 1 a.m. The roads were quite crowded with vehicles. Remember, I lived in Germany for many years. And now for someone like me, just knew about those two countries, I can tell you honestly that more than 60% that have of what we see on the social media, and by the way, I do check them from time to time, and yet I'm taken aback by some of those posts on social media. Sometimes I see life is just going as normal when I look just at the street. A great part of what we have been hearing is not true. As far as the issue of Suwaida, I'll tell you about that. But when we say that those stories are unrealistic, let me tell you, I do not deny that we are still in need of reconstruction. Have we reached to the ideal situation in just in supplying power and electricity? No, we have to be realistic, but in general, overall, it is good. And before delving into the specific of Suwaida, I would like to say here that there is a great opportunity, an exceptional opportunity in the health sector in Syria. And this is a message for all the major hospitals and to all the major investors. We have just a great environment which is conducive for investments, which is quite similar to the situation in other Arab countries. We have very skilled workforce, which is relatively cheaper than other countries, and we have also highly skilled doctors and medical staff that have been renowned for their knowledge in case we invest, in case an investment for medical tourism and pharmaceutical industries. So we could really just take advantage of that. I wanted just to touch on this, and I hope this might give you an insight about what is happening in Syria. And it's not worrying, as some people believe. As far as the situation in Suwaida is concerned, since those events erupted on the 13th and 14th of last month and until today, and for us at the Ministry of Health, we have three major hospitals, the National Hospital, Shahba and Salkhab. The National Hospital in Suwaida has been affected due to those clashes, and the level of services has declined for some time. Yet, after we have reached into the deal and the withdrawal of the forces, and then I would like to confirm that the entry of the forces to Suwaida was meant to de-escalate due to the long-standing differences among two major components of this city. However, following the withdrawal of the state and security forces, somehow we have a more stable situation. Until now, inside Suwaida, we receive just daily messages regarding the sheer shortages of medicines and supplies. The Ministry of Health and I myself at the head of a delegation comprised of many doctors and medical staff, along with ambulances and medical equipment. So I attempted to go inside the city of Suwaida to deliver those services to our people inside Suwaida, along with the mission of taking an assessment, but we were denied access. The situation was not really stable, and therefore we are just providing all these equipments through the Syrian Red Crescent. Yesterday we had a meeting for three ministries, Ministry of Health, as well as the Ministry of Foreign Affairs. So the meeting was held with several international organizations in Syria, and we were quite clear that there have been just dozens of convoys that have entered to Suwaida and provided the medical care and provided the medications to our people in Suwaida.
Okay, and that was the Syrian Minister of Health, Dr. Musaab Nazzal Al-Ali, speaking to us there from Damascus.